Hello, I'm Nikki Stipik, and I'm going to be doing the Anticholinergic Antagonist medication class. Okay, so the mechanism of action for the anticholinergic antagonist, it competes with the acetylcholine at that muscarinic receptor, preventing it from activating those pathways. So think of it like a keyhole, and it's being blocked, so acetylcholine can't open the door. Okay, so these medications can affect many things, and the list is, eyes, lungs, GI tract, bladder, heart. So kind of a run through the eyes. Like I said earlier, it causes pupil dilation. For your lungs, it's going to create bronchodilation, which is an issue for respiratory patients, COPD, asthma patients. For the GI tract, it reduces motility and muscle contraction. And for the bladder, it decreases the detrusor muscle contraction. And then the heart, a mild increase actually in your heart rate. So the indications for use, or the rationale for use, there's a variety of the reasons, right? There's clinical reasons, surgical reasons, but just to name a few, there's overactive bladder. So we're gonna reduce urinary frequency and urgency. COPD and asthma patients, bronchodilation and decreased secretions. For GI disorders, it's going to reduce cramping, motion sickness, and reduce that gastric acid. For preoperative meds, it's going to dry up secretions and prevent bradycardia. And then for Parkinson's disease, it actually balances the neurotransmitters, which reduces the tremors for the Parkinson's patients. Okay, so nursing assessments before administration of the anticholinergic antagonist, we're gonna assess, right? We're gonna always assess vital signs. Especially the heart rate, because tachycardia can occur. We're gonna assess the bowel and urinary patterns. We're gonna ask the patient if they're already constipated or already having trouble urinating. We're gonna assess the neurostatus, baseline cognition level, because the older adults already have some issues with baseline cognition anyway. Lung sounds, if being used for respiratory issues, you gotta auscultate the lungs. And then also the ocular history. So if it's being used, we need to avoid it in glaucoma patients because of that increased intraocular pressure. So we're also going to assess the effectiveness of the drug, right? We're going to need to know if the drug is working and what to look for. So for the overactive bladder, we're going to look for fewer bladder spasms or accidents. For respiratory patients, we're going to look for easier breathing, less wheezing. For the GI, we're going to look for less GI cramping and motion sickness. And then for those Parkinson's patients, less tremors or reduced tremors and rigidity. And then, in other words, you want to see reduced parasympathetic symptoms, right? So we're going to monitor for adverse effects. This class is not without effects and risks, right? Especially in the older adults. Some common side effects are going to be dry mouth, constipation, urinary retention, blurred vision, pupil dilation, tachycardia, and confusion, especially in elderly patients. So if an older adult is starting to act confused, especially after starting that med, you're probably going to think it's the anticholinergic effect. And because we're talking about the anticholinergic effect, there's a little mnemonic, which a lot of people already know it. Oh, hold on, it's backwards. Anticholinergic effects. Can't see, can't pee, can't spit, can't poop. Okay, so another mnemonic is the ABCDs of anticholinergic effects. So A is going to stand for agitation and anxiety. CNS stimulation or confusion can cause those. B is for blurry vision because of the dilated pupils. C is for constipation and confusion, again. D is for dry mouth and dry skin. Anticholinergic drugs are going to dry you out like Arizona. And S is the stasis of urine. Okay, so urinary retention. So we learned about anticholinergic antagonist drugs, right? The drug class. We're going to keep this in your pocket during exams and clinicals. And a final nursing tip would be educate your patients to increase fluids and fiber. That way they're not constipated. We're going to instruct them to monitor for confusion and fall risk in older adults, okay? We're going to instruct to avoid driving until they know how it affects them. And we're going to report difficulty urinating, fast heart rate, and vision changes. Thank you for tuning in. And remember, anticholinergic antagonists may dry you out, but they're vital in managing a variety of conditions. We're going to use the ABCDs mnemonic or the can't see, can't pee, can't spit, can't poop. And we are always going to closely assess and monitor before and after. Assess. And stay hydrated because your patients probably can't.